From the health sector, it's been rapidly spreading across the region. The mosquito-borne Chickungunya virus shows similar symptoms to the dengue virus, but shouldn't be confused. And although local health officials confirm there have been no reported cases so far, Janaea Noel Ferguson tells us tonight medical officials are stepping up efforts to ensure that we don't have an epidemic on our hands.
Despite having no reported cases of dengue or the Chickungunya virus, both of which are transmitted by mosquitoes, the country is on heightened alert.
The good thing is for the Bahamas, we have continued to have screening for both dengue and chikungunya, but we have not found any cases of either. Dengue is something that we will often have pass through the Bahamas, not necessarily endemically transmitted, but we do know that we will pick up cases every now and again. So we have maybe 10 to 12 over the course of a year, but unlike the years of 2011, 2012, where we had a few thousand people that were affected, we definitely haven't seen those types of numbers at all. So we're on heightened alert, especially since both are continuing to travel through the Caribbean.
Deputy Chief Medical Officer in the Ministry of Health, Dr. Delon Brennan, says testing has increased as countries like Canada have issued warnings to its nationals traveling to several Caribbean islands, the Bahamas excluded.
For both things is we're screening more and more patients as well. So we have developed newer technologies when it comes to rapid testing for dengue that we employ in the public health sector, both at our clinics and at our hospitals. But in addition to that, we're also monitoring what our mosquito indexes are, so seeing how much of the mosquitoes we have around, either adult mosquitoes or larvae, in order to see what is the likelihood that if someone was to come in, that would be able to be transmitted.
Chickungunya, or the disease that bends, causes high fever, joint pain, headaches, and a rash. And with the number of cases reported across the region, Brennan says there have also been fears from many here that they may have contracted the virus.
As long as people are coming in with fever, they come in with body aches, you do have to be aware and make sure that we're not misdiagnosing people with one thing versus the other. So if a patient's already affected, there really isn't that much you can do for that one patient. You treat them symptomatically. There are no antibiotics or treatments that will specifically target it, but what we want to do is prevent spread within those communities. So testing within a day or so is actually acceptable so that we know once we have a case that's picked up, we know we either need to provide better either larvicides or adulticides when it comes to spraying or treating of water systems in order to prevent transmission to other people.
Now, although the dengue virus reached an epidemic scale about 2 years ago, Dr. Brennan says they have increased testing this year, and should you feel any flu-like symptoms, you're asked to go to your nearest healthcare facility. I'm Janaea Noel Ferguson, ZNS Network News.